In the fourth section of our lecture, now we will talk about the amniotic fluid. In this section, we will talk about the formation of amniotic fluid, volume of the amniotic fluid, and what's the clinical significance of amniotic fluid volume. First, the formation of amniotic fluid. Amniotic fluid is secretion here. If you see amniotic fluid secreted into amniotic sac, is swallowed by the fetus, absorbed through the gut, and excreted through fetal urine. As you saw in the previous section, we noticed that the kidneys are produced pretty late in the gestational period. So the main function here, the amniotic fluid is secreted into sac. Amniotic sac is the covering that surrounds the fetus for the protection of the fetus, and fluid in that is mainly responsible for the protection. So any injury to the abdomen, this fluid helps in the protection of the baby. So here the fluid is secreted into the amniotic sac, and this fluid is secreted or swallowed by the fetus and then absorbed by the gut and excreted through fetal urine, formed by the secretion and transudation of fluid through the amnion and fetal skin, and from the passage of fetal urine into amniotic sac. Amniotic sac develops in early pregnancy, and the composition in the early pregnancy is dialysate of fetal and maternal extracellular compartment. The 99% of the composition of amniotic fluid is water. So 99% is water, and amniotic sac develop in early pregnancy, and then amniotic fluid is present in the amniotic sac. Transfer of water may occur by transudation due to keratinization of fetal skin. So transudation, the transfer of this water is by transudation through the skin. Fetal urine provides contribution to amniotic fluid volume. So amniotic fluid also contain fetal urine that adds up to the volume of amniotic fluid. There are different factors that influence with the formation and removal of amniotic fluid. Rapid change in amniotic fluid volume. So two terms are very commonly used relating to the volume of the amniotic fluid. One is oligohydramnios, which is scanty or less amniotic fluid, and the other is polyhydramnios, which is increase in the amniotic fluid level. So there are different factors that contribute to the formation and removal of amniotic fluid. If less is produced, leads to oligohydramnios. If more is produced, leads to polyhydramnios. So oligohydramnios is there is minimum amniotic fluid volume, and then kidneys are missing. Kidneys are missing. This leads to oligohydramnios. Polyhydramnios is a condition in which there is excess of amniotic fluid. If we see this diagram, fetal swallowing and reabsorption by intestine leads to the formation of amniotic fluid, and exchange with respiratory tract, reabsorption via lungs. here. Then we have exchange across fetal skin possible only for small lipid-soluble gases. There is amniotic fluid, fetal urine also going into amniotic fluid, and then exchange net water movement between mother and fetus across chorion. These are all the factors, as we mentioned in the previous, that leads to the formation of amniotic fluid. 99% is due to reabsorption, and it's 99% is water. As a result of keratinization of fetal skin, there is reabsorption of the fluid. So this leads to, and two terms commonly used with the formation of the amniotic fluid: oligohydramnias is less amniotic fluid and kidneys are missing, and then polyhydramnias is excess of amniotic fluid. And this is usually due to congenital abnormality, impaired ability to ingest amniotic fluid, and excessive amniotic fluid volume is present. So it can be due to congenital abnormalities or impaired ability to ingest amniotic fluid. The volume will keep on increasing, lead to polyhydramnias. Next, the volume, amniotic fluid volume. If you see, this is the gestational age. The volume of amniotic fluid keeps on increasing with the gestational age. At about 13 weeks gestation, it's about 100 ml amniotic fluid. So increase in the amniotic fluid is with the gestational period. Volume increases rapidly in parallel with fetal growth, up to maximum of 1000 ml at about 38 weeks gestation. Next, what's the significance of amniotic fluid volume? Why there should be enough amniotic fluid volume present? Because if there is less amniotic fluid, which is the condition known as oligohydramnias, it leads to diminution of amniotic fluid with impaired secretion of fluid. Impairment of placental function occurs with oligohydramnias. There is intrauterine growth retardation or restriction, pulmonary hypoplasia, and respiratory difficulties present at birth. And then there is clubfoot, skull deformities, and dry neck. Amniotic fluid infusions are done. So if there is less amount of amniotic fluid, lot of complications occur, including impairment of placental function. There is decrease in the intrauterine growth. There is less development or poor development of respiratory system, and there are breathing difficulties at birth, and also clubfoot, skull deformities, dry neck. This is more present if it's due to some congenital abnormalities. Next, polyhydramnias. Polyhydramnias leads to onset of preterm labor. There is pain, dyspnea, and vomiting in mother. Uterus become very big, acutely distended because of increased fluid. So increase size of the uterus not related to the gestational age is an indication, or the amniotic fluid is excess in volume. There is excess fluid, and then second trimester or the early part of the third trimester is possible. So polyhydramnias, amniocentesis is performed. This is the test performed on amniotic fluid, and then fluid is removed by the long needle. Cause is congenital diabetes insipidus. fetus. Treatment is indomethacin. Chronic hydramnios, if it's increase in the fluid chronically, then lot of complications that can occur. Anencephaly, small head, hydrocephaly, fluid in the head, brain, esophageal atresia, duodenal atresia, chorioangioma of the placenta, anencephaly, diaphragmatic hernia. Then there may be unstable lie because of constant movement of the baby in excess fluid, cord prolapse or limb prolapse, abruptio placenta, or there is placenta is separated from the wall, postpartum hemorrhage, maternal discomfort, and dyspnea. So in condition where there is chronic hydramnios or increased fluid or amniotic fluid is present for a long time, lot of complications can occur. It's chronic hydramnios is usually with their large placenta, and the conditions which are commonly associated with large placenta is multiple pregnancy, chorioangioma of the placenta, or a mother with diabetes. Idiopathic, when no obvious underlying cause and the fetus may be entirely normal. So that was all about section 3, in which we talk about the oligohydramnios, polyhydramnios, and what can occur or what are the complications associated with oligohydramnios and polyhydramnios. Thank you for watching sqadia.com.